Amazing to be here. And I see a lot of people who I know from before. It's always nice to see them coming back. Today, we are going to have an open session, as you already know. All right. Good morning, good evening, or maybe good afternoon from wherever you are. I know some of you are like really in faraway places, and so happy to have you here. Okay, so today we are going to do a mixed pharmacology questions session, which means we are not going to focus on one particular kind of classification of medication. We are going to do it for a lot of things. And for some of you, it might be a revision because we have been doing pharmacology in our regular AppleRN classes. We have been doing it, and we talked about a lot of medication. So this could be a review for you. Okay, so good to have you here. You all have access to the chat window, and that's where I'm going to see to make sure that I see all the answers there. And so whenever we are doing questions, just go ahead and feel free to just put in the whatever numbers or options you think is the right one. Just go ahead and put it on there, and we will discuss, okay? And please don't feel bad if you don't know the answer or if you are not sure about the answer. If everybody know everything, you don't have to be here, right? So we all are together in this. Nobody is judging you. We all are going through this, biggest challenge of one of our biggest challenge in our life, which is to pass this exam, right? So just do your best. It's okay if it is wrong. What matters is that you're trying, that you are putting the effort to, figure out what is the answer. And that's all I need, right? Okay, so let's do this together. We are going to jump into the questions. And the first one, I will be showing you the question. I will read the question too, and then we will discuss them. So this is going to be the first one. A nurse is caring for a client who has a new prescription of propranolol for hypertension. While reviewing the chart, the nurse notices the following home medications. Which of the following home medications warrant further follow-up? Number 1, lisinopril 10 milligram PO daily. Number 2, atorvastatin 20 milligram at bedtime. Number 3, aspirin 81 milligram daily. And 4, albuterol inhaler as needed. So we have 4 options here, and it's about, the focus is about one specific medicine which is given here, and that is propranolol, right? So which one, it says which of the following home medicine warrant further follow-up. So whenever you see something like warrant further follow-up, just think about we are looking for something bad. Okay, we are worried about something. That's what we are looking for. So what are we worried about? What is something bad which is here? Right? Go ahead and let me know, and then we will talk about this this option and how we can apply this. Okay, so I see some of the answers coming, which is just go ahead and put your answers there in the chat window, and then we will go from there. All right. Okay. Very good, very good. Okay, I see many of you are trying, and that is awesome. I love that. All right, so go ahead. We have 1s, we have 2s, we have 4s. Okay, so we have 1s, a lot more coming. All right, so before I give you the answer, we are going to learn about this medicine, and then we will come back and see if we can get the right choice here, okay? Can somebody tell me what is propranolol? What kind of medicine is that? When you see LOL, what kind of medicine is that? It's a beta blocker. Very good. It's a beta blocker. So now when we think about beta blockers, there are a couple of things I would like you to know. And I also wanted to say that there is a free beta blocker, complete beta blocker session pharmacology lesson available in the YouTube. If you go to AppleRN YouTube, you will be able to see that. Please see that. That's a very important session where we are discussing in depth about beta blocker. But today I'm going to discuss a little bit of that just to answer this question, okay? So in our body, we have these beta receptors which are present, and we have beta 1 receptors and we have beta 2 receptors. Now, when someone is having beta 1 receptor activated, their blood pressure will go up, their heart rate will go up, the heart will pump really good. So that's what happens when the beta 1 receptors get activated. However, when the beta 2 receptors are getting activated, it is mainly in the lungs and the smooth muscles of which controls the how much air we can get in the bronchus and all those areas. So there we have beta 2 receptors. So whenever these beta 2 receptors get activated, that's when there is bronchodilation and we get more air, we can breathe better. So that's beta 1 in heart and beta 2 in the lungs. So in heart, it increases the blood pressure. In the lungs or in the bronchial area, it dilates. So what happens when we give a blocker, beta blocker? If we are blocking beta 1, it decreases the blood pressure, right? Because when the beta 1 receptors activates, it increases the blood pressure. So if we block it, it decreases the blood pressure, which is a good thing. We want the blood pressure to come down when we are giving a beta blocker. But what happens in beta 2? Beta 2 receptors, we said, it helps with bronchodilation. So if we give a beta blocker, especially like something which blocks beta 2, what's going to happen? Bronchoconstriction happens. And that's why we are worried when we give certain beta blockers. If we can give a beta blockers only to block beta 1, that's great, because we are not even touching the lung area, right? So that will be good because all we need is to get the blood pressure down. So if I can block only the beta 1, that will be great. Those medicines are called cardioselective because they don't touch the beta 2. They don't block the beta 2. Instead, they block only beta 1. Those are great. So you can see these kind of medications most commonly use metoprolol, very, very commonly used, right? Metoprolol, atenolol, esmolol, those medications are cardioselective. So we can just reduce the blood pressure without touching the broncho part of it. But the medicine which we are talking about today in the question, that's propranolol. Now, propranolol is non-selective. What does that mean? When we are giving beta blocker propranolol, it is going to block both beta 1 and beta 2. So this person is going to have bronchoconstriction. Now, who are we worried about if someone is having bronchoconstriction, if they already have COPD, if they already have asthma? We don't want to give a non-selective beta blocker. I mean, I know we are trying to get the blood pressure down, but we don't want to give a non-selective one if they also have an asthma problem, right? Now, knowing all this, can we just go back and see if we have a better option here? What would you say? Which one would be the best option now? Because we are worried, okay? We are worried because it says, which of the following home medications warrant further follow-up? What are we worried about? Yes, very good. We are worried about this albuterol inhaler as needed. Why are we worried about it? Because we know if someone is taking that, they might be having some kind of asthma, some kind of COPD, something going on. That's why they need albuterol inhaler as needed. So we need to do further follow-up and see if propranolol is okay for them. Okay. Now, I know some of you might be thinking about lisinopril because you're thinking that that's also a blood pressure medicine. Am I worried about it? Should I be worried about it? But here they have a prescription, a new prescription of propranolol for hypertension. So they are known to have hypertension. And that's why probably the doctor is adding a medicine, because sometimes in hypertension, we learned about that, how to treat it. Some kind of medicine, just one medicine may not be enough in managing blood pressure issues in many patients. They may need different kinds of medicine, different classes of medicine. We may even add a diuretic because sometimes that kind of helps to get the blood flow, the fluid out, and it will reduce the blood pressure. So between 1 and 4, if I can choose only one, which is going to be the most important for me at this moment. And that's going to be our fourth option. Okay, atorvastatin and aspirin are completely fine. There is nothing, we have to be worried about when we are giving propranolol. Are we good? Okay, 4 is the option. So any question on that? Let me show you this just in case you need to think about how the beta blockers work. So make sure that if you are getting any of this, they are say propranolol, nadolol, or timolol, or even carvedilol, I mean, those kind of medicines, always ask for any kind of history about asthma or COPD. Okay, that's going to be your major learning point for today. Be good? Can we go to the next one? If you say yes, we are going to the next one. Just want to make sure there is no questions. Okay, all right, okay, so let's go. And in case you have any question, please feel free to put it in the chat window. Periodically, I will be looking at it and I will try to answer as much as I can, okay? And if you have any questions about course or how to get or what to do, there are associates who will be able to answer you. So please feel free to put that in the chat window. Okay, let's go to the next one. Oh, sorry, this is the explanation which we just talked about. So here we go. It's a select all that apply question. And I know many times people are scared about select all that apply questions. So we are going to do some of them today. A nurse is reinforcing teaching for a client prescribed phenytoin for seizure control. Which statement by the client indicates a need for further teaching? We are looking for something bad. Okay. Anytime you see warrant follow-up, need for further teaching, additional teaching is needed, which one need intervention, okay, or the staff nurse has to intervene. So when you see those kind of wordings in the question, always remember, we are looking for something bad. We are looking for something incorrect, okay? So what is it here? It's a select all that apply question. Number 1, I will include more green leafy vegetables in my diet. Number 2, I should take my medication on empty stomach. Number 3, if I develop a rash, I will notify my healthcare provider right away. Number 4, I can stop the medication once I have been seizure-free for a month. Number 5, I will avoid taking herbal supplements unless approved by my provider. And number 6, I must schedule regular blood tests while on this medication. All right. I know it might take a little time because it's a select all that apply question. So I'm going to give you some time here. And everyone, okay, go ahead and put your comments or put your answers. Like I said in the beginning, don't worry about it being wrong. Nobody is judging you here. Okay, no one, I promise. We are all together in this one. All right. Okay, good to see. Good to see so many answers coming. Awesome. So, couple of things to remember. It's about phenytoin, which is a seizure medicine, right? And it's about bad things, something which they should not be saying. Okay, that's what we are looking for. So anytime you get question or whenever you're going for the exam, just make sure that you will get a board where you can write, some marker and a small whiteboard. So always, especially if it's a select all that apply question, just write down there, am I looking for something bad or good? You can just put a tick mark or a cross mark, it's okay, but have that in your board there. So that way you are not going to miss in between when you are thinking about each option. Okay, and the reason is there is negative marking for select all that apply question. So you don't want to lose anything by silly mistakes, that you knew about it, but because you forgot whether you're looking for a good thing or a bad thing, you kind of missed it. So we don't want any kind of those mistakes because we want all the points we can get, right? All right, so I see 2 and 4 being the most common answers, 2, 4, 5. And guys, this is my water bottle. So you'll see me using it in between, okay? All right. Okay, let's talk about this. Let's come back after this. So this is about phenytoin, and these concepts are going to be very helpful for you. especially when you're reviewing all these medications. Okay, so the main thing about this, because we are talking about the teaching part of it, there is so many side effects and how to manage this condition that we need to teach the patients. Now, it is contraindicated when somebody has AV block or bradycardia or they're allergic or hypersensitive. I have taken this part from our AppleRN course on pharmacology. So this is just one small part of it. So you will see that there are some things we are worried about, especially Stevens-Johnson syndrome. Okay. Now, Stevens-Johnson syndrome is something which people may say about a rash. So let me show you the picture. So this is how it's going to end up. So it's like the epidermis is kind of coming back. It may start with a rash. So anytime there is a rash, if the patient is taking phenytoin and they are developing a rash, they need to let the doctor know because it can go into serious condition. This is bad, really bad. The patients can get sepsis and it can be really fatal. There can be shock. Okay, so we don't want the patients to go into this. And that's why whenever they talk about some kind of rash, when they're taking phenytoin, they need to let the doctor know we may have to stop the medicine. Now, the other problem which can happen is blood dyscrasias, which means it can affect the blood cells, the blood counts. Also, phenytoin, we need to make sure that the therapeutic levels are there. We don't want it to be too much. We don't want it to be too low either. So blood test will be needed in between regularly. Whenever the doctor says they have to go, they will need to do the blood test so that we know there is no blood dyscrasias going on, like the RBCs, the WBCs, the platelets, and everything is okay. Plus, we can make sure that the therapeutic levels are maintained. Okay. And we don't want any herbal supplements. Now, that's like patients should not be taking anything themselves. Now, if they have been taking a herbal supplement, they talk to the doctor about it, and the doctor says, okay, this herbal medicine is okay, but don't take that. Like the doctors will know which one is fine. If the doctor approves it, they can. But otherwise, we will tell the patients, don't take anything just by yourself. Just let the doctor know and let him decide. And if the doctor says, okay, yes, you may. Okay. Never, ever stop this medicine yourself. That's something that we are going to tell to the patient. Now, if the patients are complaining of that rash, and if you think it's Stevens-Johnson syndrome, the doctors may decide to stop the medicine, but it is for the doctor to decide, not for the patient, right? They may be seizure-free for some time. That doesn't mean they can stop the medicine, because when they stop the medicine, it will come back. We know what seizure is, right? It's abnormal electrical activities and discharges which happens in the brain. And those areas are managed with anti-epileptic medication like phenytoin. So if they stop that medicine, all those things are going to get reactivated and the patients may end up having seizure. Okay. Now, to maintain that therapeutic level, they need to take this medicine same time every day, not as they please. So sometimes we say to the patients, like, for example, if for my mother, I mean, she takes medications for diabetes and hypertension, and the doctor said, oh, you can take it after your breakfast. And if you ask her, did you take your medicine? And she will say, yes, after the breakfast, I took them. Her breakfast can be 9 a.m. in the morning one day. Her breakfast can be 11 a.m. in the morning next day. Sometimes her breakfast can be a brunch, which is about 12 noon. Okay, so just saying that take it after breakfast may not be a good idea. It has to be specific. Like we may have to, those kind of medications which has this therapeutic index and so important medications like this, they have to be given a time. So it will be more like 8 a.m. in the morning. So, okay, preferably with food. We want them to take it with food because these medications can cause, nausea and vomiting and stomach upset. So it's better to take it with food. And let me show you some more information about that. This is another problem which is very common with, with this kind of medications. It's called gingival hyperplasia. and you can see that there, gingival hyperplasia, where the gum is kind of growing and then it can bleed. It's painful and it can bleed, and this is a bad situation. So whenever somebody is given phenytoin, we need to tell them to be preventive, act before this happens. Okay, so we have to help them with teaching them oral care, brush and floss properly, and make sure that they do take care of that so it doesn't go into gingival hyperplasia. The other effect, I mean, here we already said, take it with food. So that's something which is important. The other thing is about folic acid. Now, patients with phenytoin have a tendency to be deficient in folic acid. Okay, folic acid deficiency is a side effect which can happen. So what is some food items which has a lot of folic acid in them? That's green leafy vegetables or fortified cereals or legumes, and all those things have folic acid in them, and it's good for the patient to take them. Okay, and also vitamin D and calcium, we tell them to take them or have some sunlight and exposure so they won't develop osteoporosis. So those are some of the side effects. I'm not going through each one, but I'm leaving it there for you to see what they are. We discussed all of this in detail in AppleRN course. Okay, everything is discussed. But today, for the sake of doing more questions, I'm just focusing on what the question is asking. So we learned about take it with food. We learned about folic acid. So green leafy vegetables are a good thing to do. And we talk about how the Stevens-Johnson syndrome can come. And we talked about it's important to do blood works. And we also talked about we would like to avoid herbal supplements unless the doctor says it's okay, right? So now knowing all that, let's go back to our question and see if we can get the answers right. So a nurse is reinforcing the teaching and we are looking for something bad, need for further teaching. First one, I will include more green leafy vegetables. Good thing to do because we want the folic acid to be there. We don't want any deficiency. So one is a good thing to do, not our answer. Why it's not our answer? Because we are looking for something bad. Now, 2 is our answer because it says I should take my medicine on empty stomach. And we know that it can cause stomach upset, nausea, vomiting, not a good thing to do. So that's our answer. 2 is our answer. Okay. 3, if I develop a rash, I will notify my healthcare provider right away. Good thing to do. We want them to notify right away because what if it is Stevens-Johnson syndrome, right? So that's why it's a good thing, so not our answer. So far, our answer is going to be only the second one, right? Only the second one is our option. Now, 4th one says, I can stop the medicine once I have been seizure-free for a month. No. You cannot stop this medicine yourself. And we would most probably, this is going to be a continuous management of the seizure activity. So no, they cannot stop it. So this is again going to be our answer because we are looking for something bad. Now, 5th one, I will avoid taking herbal supplements unless approved by my provider. Okay, that is a good thing. The patient is saying, I will not take any herbal supplements unless my doctor says it's okay to take them, which is good thing. Okay, and because it's a good thing, it's not going to be our answer. Because this patient knows that they should not be taking anything themselves. They should run it with the doctor first. And if the doctor says okay, then only they should take it. Okay, that's a good thing. 6th one, I must schedule regular blood test while on this medicine. Yes, we need to check for blood dyscrasias. We need to check for the therapeutic levels. We need to see what else is going on. So it is important to have regular blood check, which is good. So what is our answer then? We have only 2 options which are here, which is 2 and 4. Okay. Any question on this? Anything you would like to know more about? Is that clear? Are we okay? Yes, it's good, Sri Lakshmi. It's 2 and 4, and that's it. Okay. Now remember about phenytoin. There's it's a very, very important medication for NCLEX questions. Okay, phenytoin and everything related to it. It can come in many different formats. It can also be something like, client teaching, or what should we look for, or when should we notify the doctor if the patient with phenytoin, on phenytoin, is coming back with a rash. Please notify the doctor immediately. That's a priority. Okay, so important.